WOR, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're thinking about you. So I just gave you a news report about esophageal cancer, and I want to talk about two patients I saw this week. One was a man who had esophageal cancer, had the usual treatment, chemoradiation surgery at a big hospital in New York, and now the cancer has come back, blocking his esophagus. He saw the doctors at the big hospital. He told them he's feeling lousy. He can't eat solid food. He can't eat meat. The cancer came right back in the middle of the field, right where he had surgery, chemo, and radiation. They wanted to send him for hospice. He heard about us. He came in with his wife, who's a nurse. We offered him all options. You can always tell us no. You can tell us yes. It's a free country. The patient is the president of the United States of their body, and I tell everybody that because it's true. We can only be the advisor to the president of the United States of your body. He has a big mass in the esophagus, blocking the esophagus. He can't eat. He's miserable. He's in pain, losing weight, suffering. And he saw doctors who gave him no options. Go home and die. We spoke about radiosurgery. He came in. I told him I think there's a good chance we can open up his esophagus. There's no guarantees. There's no promises. I told him we've treated lots of patients like him. Most commonly, we can stop or shrink the cancer. He had 5 treatments. Actually, I saw him about a month ago, and he came in this week for follow-up after the 5 treatments. After 2 treatments, he was already eating better. I said, wow, this is hopeful and fast response. After the 5 treatments, each treatment is outpatient, non-invasive, no cutting, no bleeding. Come in, get a treatment, and go home. He came in by Long Island Railroad, took the railroad to Penn Station, which is a few minutes from our office. Penn Station is, Grand Central is, Port Authority. Most of the subways, trains, buses are really close. And now he's gaining weight. He's eating steak. He's eating meat, and he's happy. He's content. He's planning to go to Philippines for a family reunion. His wife is from Philippines. He's from Italy. And he wants us to treat other sites of disease where the cancer is because he's seen how effective and how quickly his cancer responds to radiosurgery. So what is radiosurgery? Ask this man. For this man who was in pain, obstructed, this man, radiosurgery means easy treatment, safe treatment. Even though he had been offered prior surgery, chemo, and radiation in the same area, we were able to safely treat it, open up his esophagus without hospital stays, infections, superinfections, bleeding, cutting, and all the other stuff. He wants to proceed. He's buying a ticket to Philippines. We're treating him. He's going on vacation. He's coming back. And we'll have another follow-up in 3 months. We usually do follow-ups every 3 months to report to the patient, the family, and to us how the treatment worked. We're like the coach in a football team. My father always said, who is the most pressured, successful coach on campus? It's the football coach because he's got to perform every Saturday. If his team doesn't win, he's out of there. Other teachers, they can flunk their students or flunk what they want, but the coach, he gets flunked himself. He gets thrown out himself. So we're like that coach. We have to prove each patient that we do the right thing. And that's what we intend to do to you if you wish to come to see us at Radiosurgery New York at 38th and Broadway. We have another patient with esophageal cancer. So a lot of esophageal news and cancer this week. This is a woman in her 60s from India, been here for many, many years, has 4 children. One's a doctor, came in with her son and her husband. In 2011, she was diagnosed with esophageal cancer, and she had lost 26 pounds and had a lot of symptoms. And again, the esophagus is the tube between the mouth and the stomach, so When people get cancers there, they often have obstruction of the food and a lot of difficult symptoms. So she went to a famous surgeon. She had chemo and radiation, and then went to this famous surgeon at a big hospital, and he removed her esophagus, even though there was no cancer left in her esophagus after the chemo radiation. She got a few follow-ups, not very much, and over the last 4 months, her voice changed, and she had pain in the throat with shortness of breath and dizziness. And her doctor there, the surgeon who cut on her, got a PET scan and showed a mass next to the esophagus where he cut. Now, he ordered an ENT doctor, a throat doctor, to look down her throat to see why she's hoarse. Well, the PET scan already showed why she's hoarse. She's hoarse because the vocal cord is paralyzed. The vocal cord is what gives us our voice. And when the vocal cord doesn't move properly, one's hoarse, like hoarse, like that. And you're hoarse because the air is passing through the voice box without stopping. The vocal cords don't oppose each other, and air is always slipping through. So she's short of breath because the air is always falling out of her lungs, and she's hoarse because the vocal cords don't oppose each other. I asked her if this throat doctor, who's supposed to see her tomorrow, is prepared to put some Teflon in her vocal cords to make them oppose, to stop the leaking of air, and she said no. He's going to do a biopsy. Well, the cancer's not in the voice box. The cancer recurred next to the esophagus. So looking down her throat is never going to show the cancer in a million years. It's the wrong tube. It's like you have hallway number 1 and hallway number 2, and you already know from the PET scan that the cancer's in hallway number 2, and he's sending the doctor to look down hallway number 1. So he's not prepared to help her voice. He's not going to be able to see the cancer. So it's totally useless procedure. And I told her that. I said, you should be prepared. The doctor should be prepared to fix the hoarseness. If you want a biopsy, he cannot go through the voice box to biopsy something on the other side of the esophagus. It just doesn't work that way. So if you want to do a biopsy, there are ways to do it. You already have this cancer. We then got the radiologist on the phone that read the PET scan from this big hospital, and I asked him, well, how far is the cancer recurrence from where the surgeon cut? Now, the surgeon told the woman earlier in the week that it's far, far away. Well, I asked the radiologist who saw the incision on the scan, and he saw where the cancer came back, and he said it's 5 millimeters. It's less than 1/4 of an inch away. So most probably where the surgeon cut spread cells there, and where he cut opening up her chest in the lung, the cancer came back. It came back in 2 sites, next to the esophagus, where he resected, and where he opened up her lung. Now, this woman had terrible experience with chemotherapy. She said she never wants to take it again. We talked about radiosurgery to treat these 2 spots. Our success rate where we aim the beam for esophageal cancer to stop it, shrink it, or make it go away is about 90%. It's easy treatment, like I've been talking about tonight. No cutting, no bleeding, no hospital stay. You just come in, 15-minute treatment, get up and go. It's pretty appealing after what she's gone through. And I spoke to her daughter. Her daughter called back the next day, who's the doctor. I spoke to the patient, her husband, the son, spent a couple hours with them, reviewed the case, reviewed the scans, reviewed the pathology. And the patient has copies of everything. So it makes it easy for them to understand, go home and analyze what we spoke about, and then make their decision. So to me, it seems like an easy decision at this point. I wish her well. Now we have another patient who came in Friday that I want to speak about. Another case gone through so much. So many patients with cancer have gone through so much, and so much of the treatment seems almost misdirected. This woman, 59 years old, she's married. She has ovarian cancer since 2007. So for 7 years, she's had ovarian cancer. She's had 6 major surgeries, debulking surgeries. She also got superinfection with infection and blood clots. So these are complications of surgery and being in the hospital, which are not unusual. We've talked on this show. There's actually, I think, about 10 million Americans who get infections in hospitals, and actually about 10% die of those infections. She had a cancer marker. The cancer marker, which is the blood test, which allows us to correlate the amount of cancer in her body, it was 104 and recently went up to 209 on April 23rd, so it's doubled. 3 months ago, her PET scan showed the cancer had traveled to the chest. Now, she was sent to me by her medical oncologist because I was told there were little seeds of cancer in the abdomen and asked us to do what's called whole abdominal radiation, where we radiate the whole abdominal cavity to try to get rid of the cancer, and we certainly do that in the proper patient. But this woman had masses now in the chest. She had a 4.5 centimeter mass in the porta hepatis, which is the area next to the liver, and abdominal lymph nodes as well. So, what do you tell a woman who's 59, had 6 major surgeries, complications, 7 years of chemo, now with cancer spreading, not responding to chemo? Well, first thing I suggested is we get her restaged and see exactly where the cancer is. We talked about treatment options. Radiosurgery is certainly an option. The beauty of radiosurgery for these masses is most likely it will stop it or shrink it. Our success rate is quite high. We're going to meet back this week. We're getting a new scan. We got everything approved and arranged for her. She's going to get 3 copies of the scan. She'll get a report. She can analyze. She was actually shocked when she heard about the report from February. No one had ever given her her previous reports. And all of a sudden, she found out what she had before. So that's what we like to do, to be able to provide patients with information and treatment options and choices. That's why we call our phone number 212-CHOICES, 212-CHOICES, because we believe we give patients choices. And you can only have choices if you have information. As my father said, chance favors the prepared mind. Well, a patient deserves to know where the cancer is, what the choices or what the options are. For this woman, she's coming back this week. We'll see exactly where the cancer is and be able to give her what we believe are new choices that are unrelated to all the surgeries and infections and 7 years of chemo that she's had since 2007. Many people ask where we're located and details. Well, we're at 1384 Broadway, 1384 Broadway. This is Dr. Lederman speaking, a board-certified, actually triple board-certified cancer doctor. We take care of patients with cancer. If you have a big lump in the breast or something and you're worried about cancer, give us a call. We'll see you. We promise to see people within 1 business day. We think it's crazy that people wait weeks and weeks and months to get in to see the doctor. No, we promise to work to see you within 1 business day. We're a private cancer treatment center. It means that you are the boss, not the drug companies, not the others, not the president of the hospital. You are our boss. You know us. We know you. There's no miles of cold corridors. There's no strange faces. There's no oodles of locked doors. The costs are markedly less in general than elsewhere. We accept most insurances, Medicare, Medicaid. You have our number. You can call us day or night. You'll speak with the doctor, not a machine, not the secretary. You'll speak with the doctor for your medical condition. So we think you should give yourself the most chances, give yourself the most choices by calling us at 212-CHOICES. And we used to say we're super convenient, but really we're not only super convenient. We believe we're pretty super because we do speak directly with the patients, not students or trainees or ancillary people. You'll speak directly with the doctor. We're located near most buses, subways, trains, Penn Station, Grand Central, Port Authority, PATH trains. It's easy to find us. Just give us a call at 212-CHOICES. Now we're going to hear from a few voices, and then we will be back with more news and more patients.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the